and how it's spread, how we can avoid it, and what to do if we get it. So coronavirus is basically belongs to family of viruses, like common cold virus. But some people, they are saying that it's had changed and adapted and mutated basically. So it's more resistant, it's more infectious, it's spreading very quickly. And it's a new virus, so it's new illness, and it affects the airways and the lungs. We actually don't know what actually is the mode of transmission. That means that how it's spread. But people are thinking that because the other viruses, they spread like coughing, sneezing, or touching, so probably it's the same for this virus as well. The commonest symptoms are cough to start with, high temperature, and shortness of breath. But there are other symptoms as well, for example, aches and pains, diarrhea, sickness. So these are the commonest symptoms of having this virus. Precautions-wise, what they actually are saying is, because we actually don't know how it's spread, because we are assuming that it's spread because of the droplet infection like the other viruses do. So they are saying just to make sure that you are doing proper hygiene, and that's the main important in hygiene is to wash hands regularly, and they are saying like 20 seconds every time, so that's the standard. And then what they are saying is that if you are sneezing or coughing, try to sneeze in a handkerchief or a tissue paper, and if you don't have that, do not use your hands like this. So always sneeze in your elbow. And if you have to sneeze in your hands, just wash your hands as soon as possible. The other few things about this virus is that, as per Public Health England, up till now, 18,083 people have been tested, and 115 has been diagnosed with this virus. Out of 115, one elderly lady who had all medical problems has passed away, unfortunately, and it has spread to every part of UK now. If you come in contact with someone who has symptoms, you can avoid them, like you have to make a distance as per WHO guidelines, 1 meter at least. And if you have come in contact with someone who has been diagnosed with this illness, then you can get yourself checked if you are having any symptoms. So having these symptoms doesn't actually mean that you have this illness, because we know that these symptoms can happen with other viruses as well. What they are advising is that if you get any of these symptoms, and if you're worried, or if you've traveled to those countries, or if you've come across anyone who has had this virus, you should ring 111. So the main message here is that do not go to your own doctors, do not ring 111 on the first time. Just go to NHS website, and there's loads of information there. And if you think that your symptoms are worrying, then you should ring 111, and they would tell you what to do. So we've got guidelines how to manage patients whom we are suspecting having this virus. Unfortunately, there is no treatment. 80% of patients who get this virus, they get cured by themselves, so they don't even get the severe symptoms. If a person gets this virus, out of 6, only 1 become very unwell, and they might need some extra medication or hospitalization. But there is no cure for it. The only treatment that's given in hospital if the symptoms get worse is they give supportive treatment, that, for example, IV drips, oxygen. China there's a trial of antiviral treatment, but it's not proven to be curative at the moment. Vaccine is still in process. Some studies, they are saying that it might be available by the early next year, so it's a long way. The Public Health England has also said that the severity of this condition is moderate, so they are expecting it to get more, and it will spread. So the take-home message is that do not panic, and make sure that you wash your hands. And if you come across in contact with someone, or if you develop any symptoms, go to NHS website. If not, ring 111. Don't go to your own GPs. Don't leave the house. If you have got more questions, sorry, I've just forgot one thing. So people, they've been asking about wearing masks. So WHO, they don't recommend wearing masks if you don't have any symptoms. If you have any symptoms, you can wear masks, but it's not proven that it's going to protect you from getting that disease or protect you from spreading that illness. If you have developed symptoms, and if you've rung 111, they would advise you to self-isolate. So that means that you are going to stay in your house, in your room. You should not come in contact with anyone. If you have had contact with someone, you should tell your own GPs or Public Health England, and they will screen them as well. You should use your own towels, your own utensils, and if you become unwell in a way that you are having shortness of breath, if you are in isolation, shortness of breath, chest pain or coughing or temperature is not settling, you should ring 111 again, and they will make arrangements to take you to hospital in isolation. If you have more questions, I'll be staying after the Jummah prayer, and if I'll try to answer as many as I can. And then I just want to pray that Almighty protect all of us, because it's just spreading very quickly. And but the good thing is that it's not very, very lethal. So as I've said, 80% just recover on their own. Can I answer any questions now?
After Jummah.
Okay, sorry.